Question number 7. The writer suggests that the potential for harm from asbestos is increased by. In the paragraph, we can find that asbestos is a naturally occurring mineral that has been linked to human lung disease. It has been used in a huge number of products due to its high tensile strength, relative resistance to acid and temperature, and its varying textures and degrees of flexibility. It does not evaporate, dissolve, burn, or undergo significant reactions with other chemicals. Because of the widespread use of asbestos, its fibers are ubiquitous in the environment. Building insulation materials manufactured since 1975 should no longer contain asbestos. However, products made or stockpiled before this time remain in many homes. Indoor air may become contaminated with fibers released from building materials, especially if they are damaged or crumbling. So we can find out from the paragraph that they're talking about asbestos. It is a naturally occurring mineral and it has been linked to human lung disease. And then they're talking about its benefits like varying textures, degrees of flexibility, resistance to acid and temperature. And then there is another point regarding its widespread use. Its fibers are ubiquitous in the environment. Ubiquitous means its presence. It is present everywhere. Now let's go through the options. Option A says a change in the method of manufacture. No, it's quite clear that this option is not given because we didn't find any information regarding any method of manufacture here in this paragraph. Option B says the way it reacts with other substances. Here they have clearly mentioned that asbestos does not evaporate, dissolve, burn, or undergo significant reactions with other chemicals. So this is contradicting the information. They don't react much with other substances. So option B is also wrong. Option C, the fact that it is used so extensively. Yes, this may be right. Because in the second line, you may see it has been used in a huge number of products due to its high tensile strengths and other advantages. And here you may see, like I said before, because of the widespread use of asbestos, its fibers are ubiquitous in the environment. So they are present everywhere and it is used in huge numbers, or in other words, it is used so extensively. Now we have got option D also to consider before we confirm our answer. Option C says its presence in recently constructed buildings. No, it got banned. Here it says building insulation material manufactured since 1975 should no longer contain asbestos. So recently, no buildings are constructed with any materials that contain asbestos. So that information is wrong. So we may confirm our answer as C. Question number 8. The word ubiquitous in paragraph 1 suggests that asbestos fibers. We have already read the entire paragraph for question number 7, so we may directly go for the options. Option A, can be found everywhere, may last for a long time, have an unchanging nature, are a natural substance. Every option here mentioned is actually right as per the paragraph. However, our question is specific. We need to find out what the word ubiquitous suggests. The word ubiquitous can be found here because of the widespread use of asbestos. Its fibers are ubiquitous in the environment. So this term ubiquitous is related to its widespread use, and widespread use means used by a lot of people in different areas. A lot of people are actually using it for different kind of things. A huge number of products are actually using asbestos. So here the perfect answer can be option A. It can be found everywhere. Question number 9. The case study of 67-year-old man is given to show that. As we go through the second paragraph, you may find one of the 3 types of asbestos-related disease is asbestosis, a process of lung tissue scarring caused by asbestos fibers. The symptoms of asbestosis usually include slowly progressing shortness of breath and cough, often 20 to 40 years after exposure. Breathlessness advances throughout the disease, even without further asbestos inhalation. This fact is highlighted in the case of a 67-year-old retired plumber. So what fact? This fact is actually explained in the upper portion. From here to here, the symptoms of asbestosis usually include slowly progressing shortness of breath and cough. So it is so slow that it often takes around 20 to 40 years after exposure to progress. And that fact is highlighted in the case of 67-year-old retired plumber. As we go through this whole paragraph, we can understand the whole story. He was on Ramipril to treat his hypertension and developed a persistent dry cough, which his doctor presumed to be an ACE inhibitor-induced cough. The Ramipril was changed to losartan. The patient had never smoked and did not have a history of asthma or COPD. His cough worsened and he complained of breathlessness on exertion. In view of his history and the fact that he was a non-smoker, he was referred for a chest x-ray and to the local respiratory physician. His doctor was surprised to learn that the patient had asbestosis, diagnosed by a high-resolution CT scan. The patient then began legal proceedings to claim compensation as he had worked in dockyard 25 years previously, during which time he was exposed to asbestos. So what you can find from this story of 67-year-old man, he was working around 25 years previously in a dockyard where he got exposed to asbestosis, and the symptoms and the breathlessness was actually advancing after a considerable period of time, which is actually the fact highlighted here with this example, which is what we can find here in the initial portion. It often takes 20 to 40 years after exposure to develop the symptoms. So this is the whole idea of the paragraph. Now let's go through the options. Option A, smoking is unrelated to the diagnosis of asbestosis. There is no such information that smoking is unrelated to diagnosis of asbestosis. They have even checked this, but in a view of his history and the fact that he was a non-smoker, he was referred to a chest x-ray because he was not a person who actually smokes, and still he developed breathlessness on exertion and persistent cough. So we cannot really say smoking is unrelated. That's not given. Option D, doctors should be able to diagnose asbestosis earlier. Here they're not talking about the inability of the doctors to diagnose asbestosis earlier. Here they're talking about if they had known about his work experience where at the time when he was exposed to asbestos, they would have definitely identified or diagnosed this as asbestosis. But at the time of this problem, at the time of persistent dry cough and the breathlessness that he was suffering, when he was suffering from the symptoms, he was not exposed to any such asbestos. That's the reason why doctors were unable to diagnose it. It's not their inability. Option C says the time from exposure to disease may cause delayed diagnosis. Yes, this is what we found here in this paragraph. It happened a considerable amount of time before, 25 years previously, and now the symptoms were developing. Because of this difference in the time period, doctors were unable to diagnose it earlier, or in other terms, it resulted in a delayed diagnosis. Option D says patients must provide full employment history details to their doctor. Again, no information. So here the answer is C. The time from exposure to disease may cause delayed diagnosis. So answer here is C. Now question number 10. In the third paragraph, the writer highlights the disagreement about. Let's go through the paragraph now. It says there are two major groups of asbestos fiber, the amphibole and the chrysotile fibers. The amphiboles are much more likely to cause cancer of the lining of the lung and scarring of the lining of the lung. Either group of fibers can cause disease of the lung such as asbestosis. The risk of developing asbestos-related lung cancer varies from fiber type. Studies of groups of patients exposed to chrysotile fibers show only a moderate increase in risk. So we are finding the risks of both the fibers here, two major group of asbestos fibers here. On the other hand, exposure to amphibole fibers or to both types of fibers increase the risk of lung cancer twofold. Although the occupational safety and the health administration has standard workplace exposure to asbestos 0.2 fibers per milliliter of air, there is a debate over what constitutes a safe level of exposure. So this is which is considered as a standard for workplace exposure by occupational safety, health and administration, 0.2 fibers per milliliter of air. But there is a debate over that particular limit. And in other terms, we could say there is a disagreement over what constitutes a safe level of exposure, what is a safe exposure to asbestos. While some believe asbestos-related disease is a threshold phenomenon which requires a certain level of exposure for disease to occur, others believe there is no safe level of asbestos. So this disagreement is based on safe level of asbestos, whether or not there is a safe level of asbestos. Some believe that that's a threshold phenomenon, that beyond a certain level of exposure the disease would occur. On the other hand, there are others who believe that there is no such safe level. So now we know what the disagreement is about. Now let's go through the options. Option A, the relative safety of two types of asbestos fibers. They are only talking about the risks caused by the two asbestos fibers. They're not talking about the relative safety. They're not telling us either of them are safe. So that's irrelevant. It can be eliminated. Option B says the impact of types of fibers on disease development. Again, no, there is no such disagreement mentioned about the impact of type of fibers on disease development anywhere in this group. So that's not given. We know the debate is about only one thing, and that has been explained only in the last part of the paragraph. Option C says the results of studies into levels of risk of fiber types. The results of studies, what studies they are talking about? No studies mentioned anywhere, so that's clearly not given. Eliminated. Option D says the degree of contact with asbestos fibers considered harmful. Yes, this is what the topic of debate is. The degree of contact, or in other words, the safe level of asbestos beyond which it can cause disease. There is no such level, which is believed by some. On the other hand, some believe there is such a level. So that's the disagreement about. So answer is D. Question number 11. In the fourth paragraph, the writer points out that longer asbestos fibers. As we go through the paragraph, you can see depending on their shape and size, asbestos fibers deposit in different areas of the lung. Fibers less than 3 mm easily move into the lung tissue and the lining surrounding the lung. Long fibers, which is the question is asking about, greater than 5 mm cannot be completely broken down by scavenger cells and become lodged in the lung tissue, causing inflammation. Substances damaging to the lungs are then released by cells that are responding to the foreign asbestos material. The persistence of these long fibers in the lung tissue and the resulting inflammation seem to initiate the process of cancer formation. As inflammation damage to tissue around the asbestos fiber continues, the resulting scarring can extend from small airways to the larger airways and the tiny air sacs at the end of the airways. There is no cure for asbestosis. From the first portion that we have read from here to here, it is quite clear that the long fibers, they become lodged in the lung tissue itself, causing inflammation. Here you may see the persistence of these long fibers in the lung tissue and resulting inflammation. So it is quite clear that the longer asbestos fibers are not moving anywhere, since it cannot be completely broken down by the scavenger cells. It becomes lodged in the lung tissue itself, or in other words, they tend to remain in the pulmonary tissue itself. So here the answer is B, which gives us the very same information. Option A says can travel as far as the alveoli. No, that is wrong, because it is not the asbestos fibers, longer asbestos fibers, that actually travel as far as the alveoli. Here you may see the resulting scarring can extend from the small airways to the larger airways and in the tiny air sacs, which is called as alveoli, at the end of the airway. So it is the scarring which could extend as far as the alveoli, not the longer asbestos fibers. So option A is wrong. Option C is release substances causing inflammation, which is the wrong option, because here you may see the information is quite clear that the long fibers become lodged in the lung tissue, causing inflammation, and then substances damaging to the lungs are released by the cells that are responding to the foreign asbestos material. So release of substance does not cause any sort of inflammation. This release of substances which are harmful to the lungs occurs only after the inflammation is caused by the lodging of long fibers in the lung tissue. So option C is wrong. Option D says mount a defense against the body's macrophages. There is no such information here. Reference regarding macrophages can be found in the initial part here. It says long fibers greater than 5 mm cannot be completely broken down by scavenger cells and become lodged in the lung tissue. So these scavenger cells, or the macrophages, cannot completely break down long fibers which are greater than 5 mm. That's the only information that we can find about macrophages here. So there is no information that it mounted defense against macrophages or the scavenger cells. It can be broken down, but not completely. So option D is also wrong, which means our answer for question number 11 is B. Question number 12. What is highlighted as an important component of patient management? Answer for this question can also be found in the same paragraph here in this part where they're talking about treatment. So treatment focus on patient's ability to breathe. As we come down here, you may see if symptoms are so severe that medications don't work, surgery may be recommended to remove scar tissue. Patients with asbestosis, like others with chronic lung disease, are at a higher risk of serious infections that take advantage of diseased or scarred lung tissue. So prevention and rapid treatment is vital. So from here it is quite clear that asbestosis is not curable, which has been mentioned here. There is no cure for asbestosis, and if the symptoms are so severe and medications don't work, surgery may be done, but that's not gonna give a patient a complete cure. Patients with asbestosis, like others with chronic lung disease, are at a high risk of serious infections. Prevention and rapid treatment is vital. So now let's go through the options to choose the perfect one regarding, because the question is about the patient management and we have read something regarding that. Option A, the use of corticosteroids. We haven't read about it. Here it says flu and pneumococcal vaccinations are a part of routine care for these patients. Patients with progressive disease may be given corticosteroid and cyclophosphamide with limited improvement. Again, that's limited improvement, and that is not what is highlighted in the text regarding patient management. So option A is wrong. Option B says infection control. This can be the answer. Since there is no cure for asbestosis, it is always better to control the infection or prevent the infection from occurring. So prevention and rapid treatment is vital. And here you may say patients with asbestosis, like other chronic disease, at a higher risk of serious infections that take advantage of diseased and scarred lung tissue. So it is always important to prevent a possibility of infection, serious infections. So option B can be right. Option C say early intervention. Don't confuse early intervention with rapid treatment. Rapid treatment means conducting or carrying out treatment in a faster manner. Early intervention means intervening early or sooner, as early as possible. So both are different. So here the main idea mentioned is infection control. So C is also not the right one. Option D, excision of scarred tissues, which is clearly and not given, no such information. So our answer here is B. Now question number 14. In the final paragraph, the word this refers to. The word this can be found here in the last line, and we know the first portion of this paragraph because we have read that for question number 13. Now here you may say, in spite of their potential health risks, the durability and cheapness of these products continue to attract commercial application. Asbestosis remains a significant clinical problem even after marked reductions in on-the-job exposure to asbestos. Again, this is due to the long period of time between exposure and the onset of disease. We have already found this information in a previous paragraph where there was a case study of a 67-year-old patient who developed the disease after a long time after the exposure. That is the same idea that we can find here. Even though there are marked reductions in on-the-job exposure to asbestos, asbestosis is still remaining a major clinical problem, not because of the present exposure, because it has been reduced, but because of the exposure that these people had in the very past or long time back. Because this disease, as we know from this entire passage, it takes a lot of time to develop. It progresses slowly. Now let's go through the options. Option A says the interval from the asbestos exposure to the disease. Yes, that idea can be found in the last line, long period of time between exposure and the onset of disease, but this is not what is represented by the term this in the last line. This is actually the reason why the term this is mentioned here. As we go through the last portion again, we can find they're talking about asbestosis and why it is still remaining a problem. It is remaining a problem because of what we can find in option A, because of this interval from asbestos exposure to disease. So this can be related to asbestosis. So option A cannot be right. Option B says the decreased use of asbestosis in workplaces, and that is not what is mentioned by this. Again, they are telling us asbestosis is still a problem even after decreased use of asbestosis in workplace. Again, the main subject is here is asbestosis. Option C says asbestosis is an ongoing medical issue. Yes, that is an ongoing medical issue because here it says asbestosis remains a significant clinical problem, which means it is still a major issue. It is still an ongoing medical issue. That can be right. Now, what about option D? Option D says occupational exposure to asbestos. No, because it has been reduced much. Here it can be seen that there are marked reductions in on-the-job exposure to asbestos. So we cannot really say occupational exposure to asbestos, which is very less these days. So we can understand option C is the right answer for question number 14. Now, question number 15. In the first paragraph, what is the writer's attitude towards the new program? Here, when we read the paragraph, we can find that an important component of a patient's history and physical examination is the question of medical compliance, a term used by physicians to designate whether or not a patient is taking his or her medications. Many a hospital chart bears the notorious comment, patient has a history of non-compliance. Now, under a new experimental program in Philadelphia, USA, patients are being paid to take their medications. And this is what the question is about, a new experimental program. The concept makes sense in theory. Failure to comply is one of the most common reasons that patients are readmitted to hospital shortly after being discharged. From this line, it is clear that the writer of this article is in support of this new experiment. Now let's go through the options. Option A says he doubts that it is correctly named. What name? And there is no such information, so that's clearly not given. Option B says he appreciates the reasons behind it. Yes, that may be true because like I said before in the last part, it is quite evident that the writer is in support of this idea. So he is kind of appreciating the reasons behind it. So that can be right, but we cannot confirm it. Option C says he is skeptical about whether it can work. No, there is no such information whether or not he is doubtful about its output. Option D says he is more enthusiastic than some other doctors. No such information. Enthusiasm of the writer and other doctors are not compared anywhere in this paragraph, so that's clearly not given. So our answer is B. Question number 16. In the second paragraph, the writer suggests that one category of non-compliance is. So we need to find about one category of non-compliance from the second paragraph. So here in the second paragraph, we can see compliant patients take their medications because they want to live as long as possible. Some simply do because they are responsible, conscientious individuals by nature. But the hustle and bustle of daily life and employment often get in the way of taking medications, especially those that are timed inconveniently or in frequent doses, even for such well-intentioned patients. For the elderly and the mentally or physically impaired, US insurance companies will often pay for a daily visit by a nurse to ensure a patient gets at least one set of most vital pills. That's a different topic. So the question is about that one category of non-compliance, which can find in the first place. Those people who are responsible, who are conscientious by nature, and they are well-intentioned patients as well. But because of their hustle and bustle or the busy schedule of their daily life and employment, and because of the inconveniently timed medications or the frequent doses, they won't be able to take medicines in the correct time. So this is the category of non-compliance. Now let's go through the options. Option A says elderly patients who are given occasional assistance. No, they are not the one the writer is talking about here. Patients who are over-prescribed with a certain drug, over-prescription not given, clearly should be eliminated. Option C, busy working people who meant to be compliant. So meant to be compliant, or you may say in other words, people who are well-intentioned or well-intentioned patients, but because of their busy schedule or because of their busy working timings and all, they won't be able to take medicine or they won't be able to be compliant. So answer can be C, but we have got to discuss option D as well. People who are by nature wary of taking pills. The term wary means cautious. So they are not talking about any people here who are by nature cautious of taking pills here. So that's clearly not given. Answer is C. Now question number 17. What problem with some patients is described in the third paragraph? Third paragraph says some patients have not been properly educated about the importance of their medications in layman's terms, or in other words, in ordinary man's terms. They have told me, for instance, that they don't have high blood pressure because they were once prescribed a high blood pressure pill. In essence, they view an antihypertensive as an antibiotic that can be used as short-term treatment for short-term problem. Others have told me that they never had a heart attack because they were taken to the cardiac catheterization lab and fixed. As physicians, we are responsible for making sure patients understand their own medical history and their own medications. So from here, it is quite clear that there are conditions which they think can be fixed or that can be treated in one go. That's not going to happen. Conditions like high blood pressure or heart attack, it requires continuous medications. So now let's go through the options. Option A says they forgot which prescribed medication is for which of their conditions. There is no such confusion mentioned anywhere here, so that's clearly not given. Option B says they fail to recognize that some medical conditions require ongoing treatment. This is what can be found here, because there are conditions which require continuous or ongoing treatment and they don't think like that. So they fail to recognize that fact. So B can be our answer, but we have got option C and D to consider. Option C says they don't understand their treatment even when it is explained in simple terms. No, that is wrong. In the first part, they are telling us that patients have not been properly educated importance of medications in layman terms. We don't know whether they are able to understand it even if it is explained to them in ordinary man's terms. So there is no such information, clearly not given. Option D says they believe that taking some prescribed pills means they don't need to take others. They're not talking about other pills here. They're talking about the same pill. They believe that if they take a particular pill for a particular condition, for that same condition, they don't have to take any more pills. So option D is also wrong. Here the answer is B. Question number 18. What does the writer say about the side effects to medication? This information can be found in this paragraph. Not uncommonly, patients will say, I googled it the other day and there was a long list of side effects. But a simple conversation with the patient at this juncture can easily change their perspective. As with many things in medicine, it's all about the risks versus benefits. That's what we as physicians are trained to analyze. And patients can rest assured that we will monitor them closely for side effects and address any that are unpleasant, either by treating them or by trying a different medication. Now let's compare the idea with the options. Option A says doctors need to have better plans in the place if they develop. They're not telling us, they are not giving us any information that they need to have better plans than the plans that they have right now. So there is no such information regarding that. So that's clearly not given. Option B says there is too much misleading information about them online. Clearly that's not given. Option C, fear of them can waste a lot of unnecessary consultation time. Another option which is not given. Option D, patients need to be informed about the likelihood of them occurring. This is right. Because here you may see a simple conversation with the patient at this juncture can easily change their perspective. And patients can rest assured that we will monitor them closely for side effects, which means side effects are likely to happen. And if that happens, these patients will definitely be monitored by the physicians or the doctors closely and addressed if they are unpleasant. So option D is the right one. Patients need to be informed about the likelihood of them occurring. There should be a conversation between the doctor and the patient to change their perspective and inform them about the likelihood of side effects to occur and inform that they are ready to closely monitor them. So answer is D for question number 18. Now, question number 19. In the fifth paragraph, what is the writer's reservation about the Philadelphia program? As we go through the paragraph, we can see, but to return to the program in Philadelphia, my firm belief is that if patients don't have strong enough incentives to take their medications so they can live longer, healthier lives, then the long-term benefits of providing a financial incentives are likely to be minimal, which means they need to know why it is important for them to take the medications. As long as they don't realize it, there is no benefit in providing incentives. There is no long-term benefit. That's what we can understand from the initial portion. At the outset, the rewards may be substantial enough to elicit a response. Yes, it may be able to create a response, but one isolated system or patient study is not an accurate depiction of the real life scenario. Patients will have to be taking these medications for decades. So this kind of one isolated or a patient study is not enough to compare it the real life scenario. Okay, now let's compare this idea with the options. Option A say the long-term feasibility of the central idea. Yes, this can be the right answer because it makes sense. They're talking about the long-term benefits of providing financial incentive, which is the central idea of this experiment or the study conducted in Philadelphia. So the long-term feasibility, practicality of the central idea. So this can be the answer. Now let's go through option B, C, and D. Option B say the size of the financial incentive is offered. No, they're not talking about how much financial incentive must be provided, or they're not talking about whether they increase, or if they increase the financial incentive, people are going to be more compliant. No such information, clearly not given. Option C, the types of medication that were targeted. No information, neither not given. No information, clearly not given. Option D, the particular sample chosen to participate. It is not about the particular sample chosen to participate. The writer here says that this study, the only study they have conducted, is not enough. And those results cannot be compared with the real life scenario, because in real life, people might have to take this medicine for decades. That's what you can find in the last part of the paragraph. So option D is also wrong. Here the answer is A. Now question number 20. What objection to the program does the writer make in the 6th paragraph? As we go through the paragraph, we can find although a simple financial incentives program has its appeal, its complications abound, which means there are complications. What's worse, it seems to be saying to society, as physicians, we tell our patients that not only do we work to care for them, but we will now pay them to take better care of themselves. And by the way, for all your medication compliant patients out there, those patients who take medicines without any sort of incentives on their own, thinking it's gonna be good for them, you can have the inherent reward of a longer, healthier life, but we are not going to bother sending you money. This seems like some sort of implied punishment. So those people who don't care enough to take their own medicine in order to lead a healthy life, they are going to get paid. And those who are responsible for themselves, who are responsible for their own health and are compliant and not getting paid, we don't bother much about you. We don't bother sending you the money. Now let's go through the options. Option A says it will be counterproductive. No, there is no information that it's going to be counterproductive or it's going to go against what is desired. So that's wrong. Option B says it will place heavy demands on doctors. Again, no information. Option C, it sends the wrong message to the patients. Okay, this can be a right one, but let's wait. Option D says it's a simplistic idea that falls down on its details. Again, nothing, no such information. The writer is not suggesting that it is falling down on its own details, so that's also wrong. Now let's explain option C. It sends a wrong message to the patients. Yes, it is sending a wrong message. And what is that message? If you are compliant, then you look after yourself. You're not going to send your money. If you're not compliant, then we are going to take care of you, as well as we are going to send you money as well. So that's a wrong information or wrong message sent to especially those patients who take their medications on time or who are medically compliant. Now, question number 21. The expression on that score in the 7th paragraph refers to. Here in the paragraph, we can see that, but more generally, what advice can be given to doctors with non-compliant patients? Dr. John Stainer has written a paper on the matter. Be compassionate, he urges doctors. Understand what a complicated balancing act it is for patients. He is surely right on that score. Doctors and patients need to work together to figure out what is reasonable and realistic, prioritizing which measures are most important. For one patient, taking diabetes pills might be more crucial than trying to quit smoking. For another, treating depression is more critical than treating cholesterol. Improving compliance is a team sport, Dr. Stainer adds. Input from nurses, care managers, social workers, and pharmacists is critical. So what the writer is trying to convey through this paragraph is that the doctors must be compassionate towards the patients. And he is suggesting that doctors and patients should work together to figure out what's a possible solution or what would be a perfect solution. And everyone, including nurses, care managers, social workers, and pharmacists, should contribute to that solution. Now let's go through the options. Option A says a complex solution to patient's problem. There is no information that this solution that the writer has suggested in this paragraph is a complex one, so that's clearly a wrong one. Option B says a cooperative attitude amongst medical staff. No, that is not what the writer is actually trying to convey through this paragraph. They need to be cooperative, but they're not talking about any cooperative attitude amongst the medical staff. There is no information in this paragraph that medical staff do not have such a cooperative attitude amongst themselves. So that's something which is not given. Option C says a realistic assessment of why something happens. What happens here and what kind of realistic assessment happens here? It's not given clearly. Option D says a recommended response to the concerns of patients. Yes, this is a recommendation. This is a suggestion. What a possible or what an appropriate solution can be. And the writer says doctors and patients should work together and doctors must be compassionate to the patients. So answer here is D. Now the last question. Question number 22. The writer suggests that his grandmother. Last paragraph says, when discussing the complicated nuances of compliance with my students, I gave the example of my grandmother. A thrifty, no-nonsense woman, she routinely sliced all the cholesterol and heart disease pills her doctor prescribed in half, taking only half the dose. If I questioned this, she would wave me off with, what do doctors know anyway? Sadly, she died suddenly, aged 87, most likely of a massive heart attack. Had she taken her medicines at the appropriate doses, she might have survived it. But then, maybe she would have died a more painful death from some other ailment. Her biggest fear had always been ending up dependent in a nursing home, and by luck or design, she was able to avoid that. Perhaps there was some wisdom in her non-compliance. So this paragraph is about the writer's grandmother, and she was not compliant much. She was not taking the doses completely. Instead, she sliced all the cholesterol and heart disease pills. Now let's compare the idea with the options. Option A says may ultimately have benefited from a known compliance. Yes, this sounds right. May ultimately have benefited, because in the last paragraph, the writer is telling us that if she had taken her medicines at the appropriate doses, she might have survived. But if that was the case, she might have died because of some other disease conditions where she might be having a really hard time. She might be dying much painfully because of any other disease condition. So somehow, in the last sentence, he says, by luck or by design, it was a good thing for her. So A makes sense. Now let's go through option B. Option B says, would have appreciated closer medical supervision. No, nobody is really telling here that she really required close supervision and things would have been different. So that's clearly wrong. Option C says, might have underestimated how ill she was, not given. Nobody underestimated anything here. Option D says, should have followed a doctor's advice. No, writer is not suggesting that she should have followed. He is just explaining what exactly happened with his grandmother, and he is suggesting that if she had followed the advices given by him, she might have died a more painful death. So here the answer is A. If you liked this video, please let me know about it through the comments, and don't forget to like, share and subscribe. You may click the bell icon to get notified from the comments. Thank you for watching.